Hi, this is Shannon and this is my lungs thorax assessment for nursing. So first I'm going to wash my hands. So use water, soap, and sing the happy birthday song twice. Happy birthday to you. 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 Right. And then I would use a paper towel to dry my hands and turn off the faucet. Hi, my name is Shannon Vanderbilt. I'll be your nurse this evening. So what seems to be going on? And what causes this to worsen? Okay, so have you had any recent vaccinations? No. What about any injuries?
No.
Any surgeries?
No.
Okay, and are you on any prescription drugs?
No.
And are you taking any over-the-counter drugs?
No.
Okay. Okay. And can you describe this breathing for me?
Just like tightening in my chest.
All right. And on a scale of 1 to 10, 10 being the worst, how bad is it?
About a 5.
Okay. And is this constant or does it come and go?
It happens with just an exercise.
Okay. Okay. So then what do you think is going on here?
I think I might have asthma.
Okay. So let's just check it out. We're going to do this assessment. So I'm going to start by seeing the shape of your abdomen. So I would be looking at this angle here. It's called the costal angle, and it should be 90 degrees. So I would start right here, and I would feel down, and make sure that's 90 degrees. And yep, that feels perfect. That's great. I would also look at the ratio. It should be 1 to 2 ratio of your pelvis. So between your pelvis and your hip, it should be about this size, and then I should make sure that it matches up perfectly. So this is perfect, 1 to 2. Okay, so also while I was taking your assessment, I was looking to see if you were hunched over in order to help yourself breathe, and you weren't. You seem to be able to breathe sitting straight up, so that's perfect. All right, next I'm going to ask you to sit, and I'm just going to look at your skin colors to see if you're having any deficit of oxygen. So I'm going to look at your tongue. Good, that looks pink. Now let me see your fingers. All right, your fingers look nice and pink, and that's great. Could I ask you to put your fingers together like this? Put your nails matching up. All right, great. They don't seem to have any spooning or clubbing, so it doesn't look like you're losing any oxygen. Next, I'm going to see your symmetric expansion. You stand up. I'm going to put my 2 fingers underneath your rib cage here and just pull a little bit of your skin and ask you to take 2 deep breaths for me. So your first one. Good, and then one more. So what I was looking for there is to see if my hands were moving equally, so that one wasn't moving one way more than the other. So I'll ask you to do your posterior side. So I'm going to pinch this skin and breathe for me. Good, and one more time. All right, perfect. So that all looks good. Next, I'm going to check your tactile fremitus. So I'm going to put the palms of my hands first on your anterior chest, and I'm going to ask you to say the words 99.
99. 99. 99.
All right, good. Let me check your posterior.
99. 99. 99.
All right, great. So next I'm going to percuss your lung fields. So by doing that, I'm going to take my middle finger and I'm going to place it first at the top of your chest here and tap 3 times with my other finger. Okay. Now I'm listening to the other side of your chest to make sure that it makes the same sound. Good. Good. Now check the side. All right, good. Everything being the same sound in your anterior. Let me check your posterior. Face this so the camera can see. Ready? right, so everything sounds good there as well. Next, we're going to auscultate using the bell of my stethoscope, and I'm going to listen to your chest sound. So I'm going to ask you to take deep breaths in. What I'm going to do is I'm going to breathe with you so that I know that you're not getting short of breath. Okay? All right, so take a deep breath. Okay, deep breath. 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 Okay, good. Now I'm going to check your posterior. All right. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. All right. So what I was listening for when I was auscultating your chest was it should have been hollowness that I heard in your bronchioli, and then in your bronchiovesicular area, which was the middle part here, I should have heard something like rustling leaves. And then in the sides here, in your vesicular area, I should have heard something like a wind noise. So everything sounds good. I hear a little bit tightness in your chest that I definitely think could be caused by the asthma. So I'm going to do a few more tests later, and we'll be able to get that settled. But for right now, I think we're good.
Mhm.
Nice meeting you.